Hi. We are Diabetes Consciousness. We are here to help you find solutions towards health. Sleep disorders are common among people with diabetes. The condition can harm sleep, and people with diabetes often report poor sleep. Evidence points to the fact that both are common health problems and are detrimental to each other. That refers to how blood glucose control can worsen sleep quality, while sleep disturbances can affect blood sugar levels and raise the risk of developing insulin resistance, prediabetes, and diabetes. In this video, we want to show you how the condition of diabetes can affect your sleep, what kind of sleep disorders occur, and some tips to improve the quality of your sleep. So let's begin. People with diabetes have higher rates of insomnia, poor sleep quality, excessive daytime sleepiness, and increased use of sleep medications. Sleep disturbances may be due to the disease or physical complications, such as peripheral neuropathy and polyuria. High blood sugar, hyperglycemia, can also cause headaches, increased thirst and fatigue, and low blood sugar, hypoglycemia, during the night can lead to insomnia and fatigue the next day. As with many chronic diseases, feelings of depression or stress from the disease itself can also keep you awake at night. Too many hours without eating or taking the wrong balance of diabetes medication can also cause low blood sugar levels at night. As a result, you may have nightmares, sweat, or feel irritable or confused when you wake up. On the other hand, people in general often have poor sleep habits. Reduced sleep, as well as erratic sleep behavior due to the lifestyle choices that are part of modern society, has been linked to an increased risk of obesity, metabolic syndrome, and type 2 diabetes. Some people with diabetes sleep too much, while others have trouble getting enough sleep. According to the National Sleep Foundation, 63% of American adults do not get enough sleep for optimal health, safety and performance. There is experimental evidence with healthy volunteers forced to enter a schedule where sleep does not occur consistently throughout the night. The result is a decrease in glucose tolerance and insulin sensitivity. The study of the causes of sleep disorders and diabetes is usually due to several factors. Therefore, a detailed history, careful examination, and relevant laboratory investigations will be required for this population's successful evaluation and subsequent treatment of sleep disorders. Your physician will ask you about your sleep patterns, including whether you have trouble falling or maintaining sleep, are sleepy during the day, have difficulty breathing during sleep, including snoring, have pain in your legs, or move or kick your legs during sleep. Keeping a sleep diary for the past 2 weeks can provide a detailed assessment of sleep patterns. In addition, physicians should examine depression using simple clinical tools on all patients. Most sleep disorders can be diagnosed with an appropriate clinical history and physical examination. However, when a diagnosis of sleep apnea is suspected, an overnight polysomnogram is also required for diagnosis. Once medical and psychiatric causes of insomnia have been ruled out, an accurate diagnosis can be made, and doctors can prescribe effective and safe treatment. Before talking about associated sleep disorders with diabetes, we invite you to subscribe to our channel and give us your like to this video. Our team is always carefully creating content that you may find valuable and make you feel safe as part of our community. We are always happy to hear if you like our content, and we appreciate your response. Also, remember to visit our other videos. We talk about topics that can be interesting to you and learn more about this health condition. Let's continue. Here are some sleep disorders that can affect people with diabetes. 1. Insomnia. It is when a person has difficulty falling asleep or maintaining sleep. Because diabetes can disrupt or change sleep patterns, insomnia can be a potential complication. 2. Obstructive sleep apnea, OSA. Obstructive sleep apnea is a sleep disorder in which a person momentarily stops breathing at recurring intervals throughout the night. The periods of stopped breathing are called apneas and are caused by upper airway obstruction. OSA and type 2 diabetes are more common in people who are overweight and obese. However, OSA appears to affect insulin resistance and glucose control even after obesity is controlled. 3. Restless legs syndrome, RLS. Approximately 1 in 5 people with type 2 diabetes have restless legs syndrome. This specific sleep disorder causes an intense, often irresistible urge to move the legs. This sleep disorder is often accompanied by other sensations in the legs, such as tingling, tugging, or pain, making it difficult to fall asleep or stay asleep. 4. Peripheral neuropathy. Peripheral neuropathy, or damage to the nerves in the feet and legs, is another cause of sleep disruption. Symptoms of peripheral neuropathy are very similar to those of RLS and include loss of sensation in the feet or symptoms such as tingling, numbness, burning, and pain. 5. Hypoglycemia and hyperglycemia. Both hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, can affect diabetics' sleep. Hypoglycemia can occur when you have not eaten for many hours, for example, during the night, or taking too much insulin or other medications. Hyperglycemia occurs when your blood sugar level rises above normal. It can happen after eating too many calories, skipping medication, or having an illness. Emotional stress can also cause blood sugar to rise. 6. Obesity. Obesity, or excess body fat, is often associated with snoring, sleep apnea, and sleep disturbances. Obesity increases the risk of sleep apnea, type 2 diabetes, heart disease, hypertension, arthritis, and stroke. As mentioned above, sleep disorders can affect not only sleep quality and duration but also glucose metabolism and weight regulation. Possible complications of lack of regular and sufficient sleep in a person with diabetes may include increased insulin resistance, increased appetite and high desire to eat non-nutritious foods, difficulty maintaining weight, increased blood pressure, impairment of the immune system and its ability to fight infection, increase the risk of depression and anxiety. Here are some tips to help you get a better night's sleep. Proper sleep habits, known as good sleep hygiene, can help people get a good night's rest. These habits can include having consistent bedtime and getting up at a similar time in the morning, even on weekends. Sleeping in a quiet, dark, relaxing environment that is a comfortable temperature. Removing electronic devices such as phones, tablets, and TVs from the bedroom. Avoid large meals, caffeine, and alcohol close to bedtime. Staying physically active during the day, as exercise can help a person fall asleep more easily at night. Learn relaxation and breathing techniques. Listen to a relaxation music or nature sounds. Avoid or minimize naps. Get out of bed and do something in another room when you can't sleep. Return to bed when you feel drowsy. Use the bed only for sleep and sexual activity. Don't lie in bed to watch TV or read. In this way, the bed becomes a cue to sleep, not to be awake. Try cognitive behavioral therapy, CBT, the first-line treatment for insomnia. Depending on your situation, your doctor may recommend diabetic sleep aids or other ways to sleep better. It is essential for people living with diabetes to practice good sleep hygiene to maximize the likelihood of getting sufficient quality sleep. In addition, all patients with type 2 diabetes should be screened for sleep disorders as part of routine clinical practice and treated appropriately. If you want to know more about this topic, we invite you to watch our videos on our YouTube channel. You'll also find the video about what does diabetic leg pain feel like. We hope this information helps you find a solution path in your life. Please support us. Subscribe to our channel and activate the bell button to receive notifications whenever we upload new videos. Leave us your comments below, if you want to know about a specific topic. Also, if this information is helpful to you, share it, and don't forget to give us our like. You're the reason why we're here. Thank you.